When we started the project, we were regularly, as GPs, visiting patients who are housebound with multiple comorbidity problems, both from a health and social care need. And what we were finding is that when we went out to see those patients, we could visit for 15, 20 minutes, but really patients needed more from us. And often what they were looking for was more of the social contact than actually dealing with their health problems, which obviously we were going in and sorting out at the visits. And our nursing colleagues were finding the same problems. So on a weekly basis, we were seeing patients who would benefit from a different type of approach and certainly continue to do so. We're getting better and better, I think, at identifying patients that are frail and wanting to manage them in a much more proactive rather than reactive way.
I don't think I've ever been involved in anything that is quite as exciting and almost exploding out in its vision. The well-being scores improved dramatically, the money it saved, the satisfaction of the individual, of the staff members involved, that whole change in ethos, change in working principles to actually think about the person at the middle of everything instead of the organisation at the middle of everything, which is sadly what so much of statutory health and social care has become. So to flip it all around and work that way, it was revolutionary, but tremendous results.
Working within the Pathfinder, all of the clinicians involved have felt a tremendous buzz from being involved in this piece of work. Actually, it's been brilliant to be able to deliver something that's so meaningful. And I think we've really enjoyed working as a team, and it's brought us closer together as a team. So that's been great as well. And also, of course, importantly, from a commissioning perspective, we've seen a cost impact in that patients are no longer attending hospital or general practice appointments with the frequency that they were, and their demand for social care is slightly reduced as well. We talk about this being a quiet revolution. I think this is really something that is embedded within the community, and it's coming from the ground up. So it's little ripples moving across the pond, but what's important is it's having a big impact. And we're genuinely seeing massive changes from what feels like quite a soft approach to patient management.
Everyone is up for this and gets the whole idea that this is the way we need to look after people. And it's a fundamental rethink and a reshape and refixing your attitudes of how we address the problem. It's never been involved in anything like this before, and it's hugely satisfying.
I think all of the patients' stories have been really heartwarming, but of course there are several that stand out on an individual basis. The patient who wanted to walk his dog and was able to achieve that. Somebody where if I was visiting and I didn't get an answer, I would have been concerned that he was lying on the floor, unable to get up, and then to find that actually he's out and he's walking his dog. I mean, these are really lovely tales.
An example I heard only yesterday was a couple who hadn't been out of the house for 6 months. And Age UK, there was a referral they'd picked, they went round and saw them, and they've taken them to the local new supermarket. I took them there for tea and cake and let them have a look round. They'd not seen it. And they were delighted just to leave the house for 6 months. And it's those soft skills that statutory health and social care, it's those elements that don't pick up. We look after people in their home and we take them their meals and their carers and their commode and we take them their health care. But so often we forget to ask them, well, what do you want? What's important to you in your life? So the Changing Lives Project just flips that all around, and it's humbling really when you think, actually, how bad have we been doing things? This is a fantastic opportunity to really look at the individual and how can we support them in their goals.
It's been brilliant to see how many patients have actually taken part in the project and then gone on to provide that community support for others. So at the start, no patients involved with the project were providing any support within the community, but by the time the 12 months were out, 10% of the patients that had been supported themselves had gone on to provide some sort of support. So we hope that this sort of continuous chain of support will develop, and we can see that build across the community.